will start by asking you, what is it? Am I using the right term? First off, is it tester observer?
Tester observer, yep.
Okay, and can you kind of take a little time to describe what exactly that is, being a tester observer?
Sure. So the way the Alliance of Therapy Dog works is that they have members all over the country, and the way that you become a member is to pass a test and also 3 observations with your dog, and you're considered a dog handler team. So let's say that I had somebody else in my household and I wanted to be a therapy dog handler with her, but then somebody else in my household also wanted to do that. They'd have to test separately, because it's, we're a team here, and also whoever else in my household who would want to handle her, they would be considered a separate team. And so my job as a tester observer is to watch these teams in action and make sure that they pass the sort of the evaluations that the Alliance of Therapy Dogs sets out for, and also just to make sure that they're appropriate and they're going to be safe in whatever environment that they happen to go in as a therapy dog team. So that both, the handler knows the rules and that the dog sort of follows the rules.
And so describe kind of what your therapy dog process was pre-pandemic. How often would you go into facilities? Where would you go? And were you mostly going with your dog, or were you mostly going with other people testing their dogs?
Sure. So I actually had my first therapy dog, who I regularly visited Huggins Hospital in Wolfboro with, and we went to a variety of nursing homes, but Huggins was the last place that we visited on a regular basis. And we did that at least weekly, and usually spent at least a couple of hours there. And then she actually passed away in December of 2019. And so at that time, Miss Thing here was a pretty young puppy, and she's a very, very bouncy, very energetic girl. She loves people, but is not really appropriate for hospital visits. And she also only got certified as a therapy dog. She I think got certified fully the week before the pandemic shut everything down. So we weren't really able to do any visits at all. With her, she hasn't had any official sort of medical center therapy visits because she got certified right before everything started. So we've done lots of visits, but they're more, let's see, where have we gone? My doctor's office, I go to a chiropractor on a regular basis, and they're dog friendly. So I bring her in, and sort of that's a therapy dog visit sort of a thing, because it's an agreement with them. And then very, very recently, now that schools have started opening back up again and there's sort of protocols in place, we've started volunteering at an elementary school in Barnstead. And we go on a weekly basis for about an hour, and that's sort of her thing. It's different dogs, it's different environments. So in terms of a comparison, I'd say that, for me, it was a long gap. It was a long kind of sad gap. I really enjoyed, with my first therapy dog, I really enjoyed going to the hospital. It made people's day. I heard a lot of things about how much they missed their dog at home, how they couldn't wait to get back, how, I heard stories about their dogs and what that was like. And it was a lot of fun sort of cheering them up for the time that we were there. So having this, year plus basically off from doing that kind of work has been pretty sad, both for me and I think for Ari, who was, so ready to go in and play. I have a connection with UNH, and we were really excited about going onto the UNH campus and doing stuff with college kids, and that's no more. We don't go into I also teach a therapy dog class to prep for passing the test. You don't have to have a therapy dog class in order to pass the ATD test, but it helps if you're worried about doing it. And so it's been really challenging to even get people who are trying to pass the therapy dog test the right training, because it's not that we can't go into nursing homes, it's that there's a side of it that nursing homes until very recently didn't want us there, understandably so. We don't want to risk exposure to the patients. And also now it's sort of a side of, I'm not fully vaccinated. And a lot of the, the people that are my age that are trying to volunteer, we're in the last vaccination groups. So a lot of us are not fully vaccinated or fully protected. And, the vaccines aren't 100%. And I don't want to be that guy who, in the effort of doing something good, possibly puts other people at risk. So there's a consideration for how long do we wait before going back into these medical facilities with people who are vulnerable. So that sort of changes the landscape. A lot of the teams, hi Garly, a lot of the teams that I've tested in the past, I'd say 6 months. I mean, obviously there was this huge stop. I didn't test any teams for a very long time. And then I'd say in the last 6 months, I've passed, I think 3 teams, and I have 4 more teams that are at the end of my class and ready to be tested. They're, for the most part, not looking at going into medical facilities, and I mean, or it'll be a mix of medical facilities and other things, and that's just because we don't know when we're going to be allowed back in, feel okay, going back in, stuff like that. So the focus has sort of shifted to preparation in public places, which is difficult. A public facility and a medical facility are not the same thing. And also that exposure to kids. I've gotten a lot of teachers who want to bring their dog in as be a therapy dog at their school, and that seems to be sort of the next wave, that more than I've seen in the past. I've been a therapy dog person now for going on 8 or 9 years, a therapy dog team, not a tester observer. And I've seen more and more requests for schools, and can I bring the dog into school, and or the read program where the kids read to the dogs. That I've seen a big skyrocketing request for that, which is, I mean, it's great. It's just a different sort of preparation, and a different sort of dog. Huh. Yeah, we like kids.
So what do you think, Ari, or I guess you might not totally know with Ari, I guess, just because she's new, but what do you think, I guess, the dogs in general, what do you think they miss on their end? Do you think they sort of feel like it's a job for them? Do you feel like, I mean, they know what they're doing, I guess, sort of, what do you think the dog misses out on by not being able to go into the...
Oh yeah. Well, I mean, there's 2 different things. She certainly knows, like we have equipment. We do a lot of dog sports, and I have equipment that is, when I put on this piece of equipment, you're going to go and do this job. So she has a harness that is her therapy dog harness, and she knows when the harness goes on that she is in therapy dog mode, and she's expected to go away from me and greet me and kind of hang out with the people that I ask her to hang out with. And so she's aware, she sort of turns it on and turns it off again. And there's a higher level of obedience and expectation associated with being a therapy dog than just being sort of an off dog like she is right now. So I do think she misses it. It's a great opportunity. And certainly, like this week, the kids at the elementary school, well, they're on vacation, so we're not going to get to see them this week. I know she will miss that for certain. Because there's an interaction and sort of a level of meeting and being with different people that I think any therapy dog or any dog that wants to be a therapy dog really enjoys. I'm here 24/7, and I work from home now, so she sits next to me, and I'm quite frankly really boring. I'm a boring, I sit and I stare at this stupid screen all day, and it's very boring for her. So being able to go out and meet people and get love-ins and sort of enjoy, being exposed to different people and being really excited to be around new people is something that she really wants. So it's a great opportunity to do that. And of course, I'm single, I don't have any kids. So going to the elementary school and spending an hour with these kids that are, 8 or 9 years old and are just absolutely over the moon thrilled to see her it's just a wonderful thing. I look forward to it every week.
So do you think it's going to open a new avenue, sort of? Do you think even when, it's hard to say when things will be completely back to normal, but do you think you'll start to incorporate schools more, for the foreseeable future because of that?
I do. I mean, when I started as a therapy dog team 8 years ago, it was sort of the big direction was nursing homes and hospitals and hospice and things like that. And I never really even considered bringing my first therapy dog anywhere else, because I thought this is where you went, right? You went to these people. So I think the landscape has shifted a lot towards, I mean, obviously the people in the medical facilities still need the visits, and there are dogs that are very appropriate for that. But knowing and actually getting the outreach from schools saying we would love to have these dogs come in and we know kids that could really use them, I think it's going to sort of shift a lot of people's minds towards the younger crowd also, which I think is a wonderful opportunity for everybody. I mean, everybody benefits from it. So we had a couple of weeks ago on one of our visits, the teacher said to the kids, would you rather go to recess or would you rather go see the dogs? And the kids were like, I want to see the dog. I mean, it was an immediate thing, which is unbelievable that they'd rather stay in a classroom and hang out with this dopey dog than go and run around outside. But there was no hesitation, it was great.
Dog for sure.
Yeah.
Dog for sure.
Trump everything, don't you, kid?
So, and maybe you've researched this, I don't know how far, I don't know the science of it or anything, but just from your own firsthand experience, like what can a dog do for a person that another human can't do for a person? You know what I mean? Like what, when these dogs come into schools or nursing homes or whatever it is, what is it that they do that you just can't get from humans?
I think there's a big lack of judgment when you're talking to a dog that does not exist when you're talking to a person. That you know that the dog is not going to judge you in any way, or that they're not going to, there's no verbal communication back again on a dog's part. So there's no fear of getting a response that you don't like or being hurt, like emotionally from a dog. So I think that a lot of both kids and adults feel very safe around dogs, as long as they're comfortable with dogs, they feel very safe around dogs and feel safe talking to the dog. Whereas, talking to me is a different story. I'm another human and I respond. So it's funny that I joke all the time that people don't know me. They don't know my name. They know Ari. They know Ari's name. They know that I'm the girl with the dog who comes in every week, and it was absolutely like that with my first therapy dog too. It was, oh, you're Kyra's owner. It wasn't, oh, hi, Sarah, you're the one with the dog. And I think that's because there's a lot of times when I'm just the person at the end of the leash. They don't even know what I look like, they know what Ari looks like. They know what my first dog looked like. Yeah, I think it's a matter of, safety and knowing that that dog is going to come up and wiggle at you no matter what, and that you can say whatever you want to that dog, and there's no, that the response is going to be positive. And I also think that it triggers a lot of good emotions in people that have good experiences with dogs. There's something where we go into in nursing homes, when we go into rooms, or if I'm meeting somebody and they look a little unsure, I say to them, is it okay if you want to meet the dog? Is that all right? If they say no, then okay, there's no meeting. That's fine. I respect that. But if they say yes, and usually after that, they just sort of melt into a little puddle of goo. That's just a wonderful thing. And I have a science background. I've got my science shirt on. I don't know much about the psychological part of it. I do know that, petting dogs is supposed to lower blood pressure. It's supposed to release serotonin and all these good endorphins. And I don't think there's any doubt that actually happens. I just I see people's memories click, especially in the nursing homes. I always see people who are like, oh, I had a dog like that back in '82 and they were the most wonderful dog, and they'd smile and they'd sort of talk about it. And I don't know if they're talking to me or if they were talking to themselves and sort of reliving that wonderful memory. But it's certainly a benefit, I think we always left people happier than they were when we came in. You just sort of can't help it. And the kids don't have those memories. They just love running around and screaming and laughing at her. So that's the best part. That kiddo, good girl. She's staring at the cheese that I have on my keyboard right here. Yeah, you know where the cheese is. You're a good doggo.
So Ari must be what, 2 years old?
She just turned 3, actually. Yep.
3. Yeah. So, wow.
Yeah, it took her a little while. She's a wonderful dog, but she's just, like I said, she's very bouncy and happy. So I waited a little longer than I would have to certify her, just because at the time, pre-pandemic, you have to go into 2 medical facilities as part of your observations in order to pass. And I just didn't want her bounciness to interfere with anything. So I waited until she calmed down a little bit before I tested her. Now you are right.
Have you noticed any, or has there been a noticeable increase in people who have reached, I don't know how it works if they reach out directly to you, but have you noticed an increase in people now as we're starting to come out of it? Or
oh yeah.
Oh, interesting.
Oh yeah, very much so. Yeah, so I got certified as a tester observer. It was pre-pandemic, but not very long pre-pandemic. I want to say like maybe January of 2020. Hi, could you not do that? Thank you. Sorry, she was standing on me trying to get close to the cheese. And I know I'm one of the only TOs in my general area. And the way it works is that prospective members, there's a list on the ATD website. So prospective members basically look at who's closest and then give them a call. And I was getting regular requests. I had 3 or 4 teams that I tested before the pandemic started. And then, the initial sort of order from ATD was just stop everything for the moment. We're only going to test if your guys are comfortable. Right now, nobody's comfortable doing anything. And they waived the medical facility requirement almost immediately, obviously. And so I believe I might have tested 1 out of the 3 of, oh my goodness. Sorry, my face
all about that. Yeah, so I'm still living with my parents through the pandemic, and they've got 3 Jack Russells and the golden retriever is.
Oh yeah, so you know all about it then.
Oh,
yeah.
the barking.
Goodness, you are such a fearsome beast. Anyway, so I was getting regular requests before the pandemic hit, and then everything shut down, and I didn't hear anything for, easily 6 months. It was fall before I got any other requests for teams. And even then, when they called and said, can we test? It was one of those, sure you can, but be aware that there's nowhere for you to go right now, and I'm welcome to pass you, and you can pay your dues and do what you need to do. But if there's no visits, then if you feel like it's better to put it off, then put it off, And they said for the most part they wanted to test, and so I proceeded, and that's fine. But then in the last, I'd say probably 2 months, I've gotten more requests than I ever have before, and it's been a wonderful thing, to know that we're finally getting back to normal, and that people are willing to sort of go out with their dogs and do this volunteer work. And also that I think a lot of it now is that, like me, everybody, well, not everybody, but people are working from home more and more. And so they're spending more time with their dogs. They have a better bond, and they're, well, let's get out and let's share that with other people. I think it's great. So.
Yeah, that's really cool.
Yeah. Are you done? Are you being, yeah, you have a piece of cheese for being a fearsome beast. Yeah.
And so are you basically just following the news? In terms of, the medical facilities reopening or whatever, you're just kind of waiting. It's a waiting game.
Yeah, that's basically it. I'm in contact with a couple of them that we could possibly go back to, but right now, and ATD has sort of directed us that nothing is going to return to normal in terms of the testing procedures and in terms of visits until about June, and they're going to look at June and say, okay, we're going to sort of reevaluate what's going on. But just for me personally, I've got another week till my 2nd vaccine. I've got another 2 weeks until after that, until the immune response is really up to it. So for me, it's just not even a consideration for me to go anywhere where, where there's medically vulnerable people if I'm not fully vaccinated myself and could carry it to other people. So, yeah, I follow the news, and I'm sort of looking forward to getting reopened and getting back up again, because I know that the people who are contacting me do want to go into the medical facilities, some of them, and it would be great to be able to do that. I'm just kind of sitting back and waiting, quite frankly, until after everything is, clear and we're more comfortable doing it.
Great. Is there anything else that you want to say, or anything else that comes to mind?
No, I don't think so. It just, I can't even, I think, express just what a wonderfully rewarding thing it is to do. A lot of my best visits, I can't talk about because of HIPAA rules. The visits that I've had in hospitals and like on the psych wards and things like that, that it really is just amazing how people change when they see the dog and how much it cheers them up. And I guess I'd just say I'd encourage anybody who just has a very friendly, outgoing, and also well-behaved dog to consider it, because I don't think you really realize the effect it can have until you witness it. Like,
Yeah, what's the oldest dog you've ever trained? Like, you know, you can't teach an old dog new tricks or whatever, but there must be a few that have come later in life. Or,
yeah. Well, I mean, my therapy dog was 10 when she passed away, and she did it right up until kind of the last week, and loved every second of it. I have I believe Sizzle is 9 years old right now. She's a spaniel. She's great, and she's just, you know, a very chill girl, and I think she is going to be one that would be great in a medical facility, because she just sort of strolls around and is like, hey, you want to pet me? Awesome, pet me, you know. And that's going to be it, you know. I don't actually think that age is much of a factor, except for in the tiredness part of it, because it's very mentally draining for the dogs as well as the handlers, but really for the dogs to sort of be attentive and be with strangers, and you know, yeah, they have fun too, but it's really mentally tiring. So I think that older dogs just wear out a little bit faster, and the handler has to sort of be aware of their, you know, their emotional state and take them out of the situation before they get too far down that road. Huh, Gorilla? As opposed to you don't tire out ever. So, but no, I don't think age is a factor. I mean, minimum age, I think, is more of a factor than maximum age.
Yeah.
I think you could take an old dog in and they would have a blast doing whatever, as long as they're enjoying it. That's the big part.
And how do you pronounce your last name? Is it Julian?
Julian, yeah.
Julian. Okay, perfect.
Yeah.
Well, I have to say those are very fascinating and interesting insights. I'm so glad you're so experienced, and that you were able to offer those kind of all those different perspectives from before COVID and all that.
Yeah, well, I'm thrilled that you're gonna get a story and get this out there, because I think that there's two sides to this. One is that I don't think a lot of people know what a therapy dog is or what they do. We get confused a lot for service dogs, and it's, I mean, I guess it's appreciated that people think that my dog is so obedient that she could be a service dog, but there's also the part of, no, you can touch her, it's really okay, you know, that sort of a thing. But then the other side of it is, I'm not, like, I don't get contacted by organizations a lot that say, come and be a therapy dog with us. You know, Barnstead Elementary contacted us and said, we're interested in bringing dogs in, but that is more rare than you would think. So getting the word out that there are a lot of teams out here, and that we, you know, there are a lot of dogs that are tested and certified, and we are available. Usually what we do is we call places that we know and say, do you want a dog to come in? And they say yes or no. So having more of a word out that we have these therapy dogs and we're willing to do it it's a wonderful thing. I'm thrilled that you're doing the story.
Well, thank you very much. And yeah, I actually had one of my mom's closest friends. Her family just got a little golden doodle puppy, and she has the exact same desire. She's a teacher, and she wants to have the dog trained, that she could bring the dog in, because she works with you know, special needs kids and stuff in school, so she'd love to bring her dog in. So, but that was the first I had really thought or heard about you know, a teacher doing that with the intention of bringing it into her own school. But it's a great idea, I think. Yeah,
I mean, I taught for 10 years, and the thought that I could have had a dog with me to I don't know, diffuse situations or pre-test, and, you know, just have them there and available to pet. I think that would have been amazing. You know, I just, the way that I taught high school, so the way that the kids would interact, I think it would have changed a lot with a dog around. So I don't know, it's an interesting thought. I'm actually excited at the thought that, you know, I'm sure that only certain teachers in certain situations could do it, but that there is even a therapy dog available or around, or kids know that maybe once a week there's a dog here, that I think that would be really great. Yeah, maybe it's a whole new wave. That would be awesome.